Hello, these are Flip Notes 5.6 and the first of our two sections on treatment. And our first one is about research and trends in treatment. So, psychotherapy in general just refers to the idea of talk therapy, that there's a relationship between a therapist and a client. So one of the big questions is therapy effective? And through meta-analyses, which we've learned before is by looking at and comparing lots of other studies, meta-analyses consistently demonstrate that yes, psychotherapy is effective for treating a wide range of disorders like depression, anxiety, PTSD, and more. So yes, psychotherapy works better than nothing, basically. Different evidence-based interventions and treatment plans. So when it comes to what makes a treatment plan effective, the biggest factor is the relationship between the therapist or the provider and the client. But you also have to consider client factors, like is the client ready to change? Because the way they have been behaving and feeling has been maladaptive. So they have to be ready to want to change that. Pressures and relationships from life outside the therapy session. So sometimes life is happening, and that can make factors like readiness difficult. And then another big factor is treatment by medication, not just talk therapy. Remember, we've learned that therapists and psychologists are not able to prescribe medication because they're not medical doctors. You need a psychiatrist or a physician for that. So usually it involves teaming up with a psychiatrist or their general physician to treat both by medication and with talk therapy. Clients who don't work well with one type of therapy will often respond to a different, or sometimes it just means switching therapists. So people shouldn't give up after trying one way and it didn't work for them. A couple other things that influence how effective psychotherapy are cultural humility and having a therapeutic alliance. So cultural humility is the idea that therapists and their clients should be just constantly have this self-reflection about, is this working? Does this match my lifestyle and my culture? So therapists have to recognize that their own biases and their own beliefs in their client can affect their treatment. A lot of it has to do with cultural background. Not everybody is the same, and a lot of people's backgrounds don't match up with their clients. Historically, therapists were for a long time white males, and most of their patients were not all white males. So being able to understand different perspectives is very important. Today, we live in a very diverse society, so being able to treat somebody who's of a different cultural background from yourself means having cultural humility. Therapists can practice that cultural humility with their continuous education, learning about other cultural practices, having supervision and consultation. Most therapists don't work entirely alone. They work in alliance with other therapists, and they meet together to talk about their clients confidentially, to talk about how they can help each other, and if they're struggling, how ways that the other therapist may suggest they make changes. So there we go. Keep going. A therapeutic alliance is having a collaborative and trusting relationship, again, between that therapist and client. So again, believing as a client that your therapist actually cares about your success of your psychotherapy. So there should be a mutual agreement on therapy goals. So talking about what is your goal at the beginning. For example, is a client's goal to be totally off medication? Maybe they struggle with anxiety and panic, and they want to learn ways to cope with that in a way that wouldn't require being on medication? Or are they okay with being on medication long term? A strong emotional bond. So if the client's not comfortable talking and sharing deep feelings about what's going on, then that can reduce the effectiveness of the therapy. And then a collaboration on therapy tasks. So sometimes therapists will give things like homework, like I want you to try doing this, or I want you to try thinking about this in a different way. So agreement that if a therapist asks them to try something, that they'll actually do it. Therapists might focus on building a strong therapeutic alliance by actively listening, showing empathy, and involving the client in setting therapy goals. So all of this goes to that unconditional positive regard that we talked about with the humanistic approach. By the therapist saying, how about we try this, and if the person says, I'm not comfortable with that, I don't want to do that, and the therapist says, okay, let's think of an alternative. What do you think you could do? That approach is going to make the client feel more valued and understood, and more likely that they're actually going to participate in the treatment and overall improve their mental health outcomes. Over time, the way treatment has happened or occurred has changed. In the late 20th century, there was a big increase in medications, and really it started in the 1970s with the drug revolution, when people were starting to try out new drugs in the 70s, and you think of like hippies and rainbow culture and all of that lifestyle. One of the big pros of that was that there was also a boost in effective medications for people who were having psychotic episodes and people who were depressed and people who were anxious, but especially the psychotropic medications, where before somebody, the only way that they may have been treated was to keep them institutionalized in a place where they wouldn't hurt themselves or others. But now with medication, they could be deinstitutionalized, meaning they didn't have to live their entire life in an institution. So increased effectiveness of medication in the late 1900s really helped get people out of hospitals. They don't even really call them asylums anymore, but hospitals. Current treatment method is basically decentralized therapy. The idea that they don't really want people to have to live in a centralized clinical setting that's there for when someone's having more of an acute episode, or if their meds suddenly stop working, or maybe they were never on meds and they suddenly start having a mental breakdown. But the goal is to not leave people living in clinical and institutional settings. Now they want to have a more community-based approach where people can come in and visit their therapist, maybe if it needs to be weekly. And a lot of it now can be used through technology. So a lot of therapists do Zoom or virtual meetings. Makes it a lot easier for people to just go to a therapist appointment by taking like an hour off of work rather than having to miss a half day of work. Even students at school will go sit like in a counselor's office and do a therapist treatment for just a quick little 30 minutes virtually, and not even have to miss hardly any of school. Ethical principles in treatment, these are very similar to the ethical or the ethical guidelines for psych in general that we talked about earlier in the year when it comes to research. They're very similar to treatment. So the first is non-maleficence, which is do no harm. So again, they're safeguarding their welfare and rights, recognizing the competency of the therapist, willing to find an appropriate treatment that's not going to be physically or emotionally harmful, recognizing if there is a conflict of interest. So again, not causing physical or emotional harm. So not, prescribing a medication that they know is going to make them feel awful, or trying something that's too quick, too fast, too severe. So for example, somebody with anxiety, there are types of therapy that involve exposure to whatever it is that they're scared of. Ideally, that should happen gradually and at the client's own pace that they feel comfortable, and not the therapist pushing them at a pace where they would not be comfortable, and that would cause emotional and psychological harm. The next one is fidelity, building trust, showing professional standards of conduct, not exploiting clients. So this means being honest with them, honoring commitments that, if I say we're going to meet once a month, then I'm going to make sure that I can fit you into my schedule once a month if I'm a therapist. Ensures that you feel secure, that I'm not going to go and share your personal information with people who are not involved. We had a person come in class and talk to us about therapy, and she said if she sees one of her clients in public, she does not acknowledge them unless they acknowledge her first. And even then, she's not going to acknowledge what their relationship is. So they're not going to reveal like, hey, I'm your therapist, to your boss who accidentally sees you while you're out for lunch. So Fidelity knows that you have that trust. Being able to know that your therapist is going to provide that consistent support, that if you're having, a breakdown at some other random time, that you're going to be able to get help when you need it. Integrity refers to accuracy, honesty, truthfulness, keeping promises, avoiding unwise or unclear commitments. So when it comes to therapy, we mean, if a therapist says, or, you want medication and the therapist says, I'm not qualified to give that to you, I can tell you what I recommend, and not trying to find some other way to give that to you. So avoiding deceptive practices. If a therapist realizes that what they did wasn't working or they made an error in a treatment plan, integrity means being honest and saying, okay, what we did didn't work, and I really think we need to try something else. I probably shouldn't have suggested that way to begin with. So being ethical means being willing to say that you made a mistake. And then our final one is respect for people's rights and dignity. Dignity, recognizing that people have dignity and they can get better, and not looking down on clients. Part of this is still privacy and confidentiality and providing safeguards to people who are very vulnerable, and being respectful to other cultural backgrounds, including maybe people who are of low income, people who have different political views, different religious views, recognizing a client's autonomy, that they're their own person and they're gonna have to continue living their life even when they're done with therapy. Recognizing that the client can decide whether or not they want to do what you're suggesting as a therapist. When working with clients from diverse cultural backgrounds, this kind of goes back again to that cultural competence and cultural humility, recognizing that if the therapist and the client are from different backgrounds, that maybe they don't understand each other. And it's up to the client to kind of say, that's not how I do things. And for the therapist to be respectful and say, okay, well, let's work together and find a way that can be healthy for them. All right, that's it on this section.